My name is Sinead Leonard. I am one of the medical SHOs and I work in the palliative care inpatient unit.
My name is Linda O'Connor and I'm a healthcare assistant in the inpatient unit in palliative care.
There is no typical day in palliative care. I think every day is quite, you never know what you're going to get when you step inside. We talked about this earlier. Yeah.
We come in the morning and we just look up at the board and we see how many patients that are going to be there today, and it's a challenge and it's emotional. So I've been in palliative 6 months. Linda's been there, you're part of the community much longer than I've been. A home health maybe for 16 years, as well as in the day unit in palliative for 12 years as well. So then I moved down to the new unit when it started up. So it's challenging, it's rewarding.
I
suppose
rewarding.
Our place below, it's so lovely and comfortable and peaceful, and even today now, the beautiful day, they have lovely rooms and they can look out at the scenery, beautiful gardens, so that alone is peaceful for them, isn't it? And their families, and to know that the families can come in 24/7, and it's just a lovely calming, it's a lovely place to work.
Yeah, it's a real privilege to work there. It's the unit was really well thought out before they actually eventually built it. They liaised with so many nursing,
other hospice
doctors,
facilities,
other hospice facilities, even things like you mentioned on a beautiful day like today. It's all about the light. It's all about the lighting downstairs, and just to make, and even the tone of the wood and the size of the rooms and the bathrooms and everything. It's really for patients and their families at what is the most difficult point that they'll likely ever face in life. If we can provide a bit of comfort, and I certainly think the building is amenable to that.
And that makes us feel good then as well. When we know that they're nice and peaceful and calm and comforted, and the family's comforted. So
there's certainly a serenity to the inpatient unit that I don't think exists
and the team
elsewhere in the hospital.
They're fab.
We're biased, but the team are pretty. And I worked up the hospital as well, so I can say that they are the best.
Really, My name is Bríd Lynch and I'm an occupational therapist. I'm one of 2 occupational therapists that work in the palliative care services here. So we work between the outpatient and the inpatient palliative care services, and we work with people at all stages of their illness just to maximise their independence and improve their quality of life, and to get them to keep living life for as long as they can, and get them doing the things that they want to be able to do.
For me, I suppose when you see the patient that they're so peaceful and in their final stages, and that the family are at peace as well, to know that there's no pain or suffering, and that's really lovely to see.
I suppose it can be very difficult, but I suppose we're very lucky that we get to work with patients in a really holistic way, that we're not just looking at their kind of medical issues, that we get to work with the patients and their family in kind of all aspects of their care.
There's a lightness and a hope in palliative care in the darkest of times, and I think as a staff and as a family, which we very much are, we're quite there's a lot of us working down there, and we've had an awful lot of losses, and we continue to have an awful lot of losses, but we help each other through. We talk about it, we support each other. If you see somebody struggling, there's an acknowledgement of that, and then we nurture each other a little bit. I think what Bríd has said though is very important. We do focus on, it is palliative care, and yes, it's often end of life care. It's not exclusively that, it's symptom control, rehabilitation, but we encourage patients, to live the best life that they can for the time that they have left, and the focus is very much on the living.
Yeah, and I suppose the wonderful thing here, and a lot of people will know that, I suppose the Kerry people are so generous. Everything that we have in the hospice is fundraised locally by the people of Kerry, so everything has come from those people. And I suppose that Teddy Moynihan was a big person for us, and he would always say that, I hope you will never need the hospice, but the hospice will always need you. So I think that's kind we have like a wonderful environment to work in with wonderful people, and oftentimes it's families that are fundraising everything.
And I suppose it's nearly said every day, thank God this place is here for the people of Kerry. Isn't it? We often say, thank God it's here for the people of Kerry.
I think for me, I have 2 small kiddies at the moment, and I suppose working here, like you work with people at such a special time in their life, but it makes you really appreciate the absolute joy in life, the simple pleasures in life, when you pare everything back, the things that are important to people. So I think every day I leave, I'm grateful that I've done a good job for everybody that's here, and I've worked with my colleagues and I've done the best for that person. But I go home then to my family, my small family, and like it's simple things, just walking in the door and getting a big smile, it makes you appreciate life.
So for me, I am not from these parts, as is evident in my accent, but I have always loved Kerry, the county, and the scenery, the landscape. Really, I think the beaches here are unparalleled. The summer down at Derrynan or Feenit, and I have friends from both here and who have moved, and they'll all say you don't get these beaches elsewhere, and they're literally on your doorstep within a few minutes of having had a terrible day, in the unit, maybe just being devastated by a loss or just stressed, and you can just take a stroll, and we're at the foot of the mountains here, and it's like really, you just take a breath sometimes and you're like, okay, it recenters you, I think.
I think the special thing as well about Kerry, from Cork as well, so flowing. Besides the football issue again, I suppose the people are really friendly and generous, and even the staff here, they kind of want to know who you are and to know a little bit about you, so it's really easy almost to make friends and have people kind of look out for you. And kind of, I've worked all my time here, but I really find that you get connections with people, and then all of a sudden you have roots and you're here 10 or 11 years, and that's it, and you kind of don't want to move anywhere else.
Me, I suppose I always value what's here as well, and sitting to the car 10-15 minutes, you're Killarney, Benna, Feenit, there's always a walk, there's always something, it's beautiful.
I think we are a lot more acute than people appreciate. People think it's, you come in and it's just solely end of life care. But no, we're quite active. Patients can be undergoing treatment whilst they're with us, and they're in for symptom management, and then rehabilitation, and working with our extensive MDT team. And we very much often work towards getting them stronger so that they can actually go home. And people, maybe when they think of a hospice or a palliative care unit, that's not the first thought that springs to mind. And we also have a daycare service in which we provide, a service for blood transfusions. So patients who are, native to Kerry but who may be, in Cork for their primary treatments, they don't have to make the journey to CUH for their blood transfusions. So we try and accommodate as much as we can patients who maybe are having treatment outside of the county, but whatever we can do here, we will. So I think that's something that people might not necessarily know.
Patients come into us every week, and a lot of what we provide is kind of group activities that maybe they're not able to do at home, some gardening or baking, and they do them kind of in a group environment. We're kind of they're supporting each other then, but then we're just finding kind of lightness in the day, and they're doing activities that they really enjoy. Often you feel so much better. There are symptoms of pain, or they might be feeling better for that hour that they garden or they bake, or that they're doing an activity with a group of people to do.
I think you might be surprised, passing through the palliative unit, both the inpatient and daycare, to hear the amount of laughter. But there is a lot of humour. And it's not just amongst it's staff and patients families, and
we'd have great crack.
We have great crack. We do with the patients, even patients who are seriously sick, but they still somehow manage, I don't know, crack a smile, yeah, it's lovely.
And I suppose we're meeting them on a journey, and oftentimes it's a really special journey for them, and we're just there to kind of walk with them, I suppose. And it's
And
Just-
sometimes, you know, when you're below, you could be walking in the corridor and you hear a burst of laughter coming out of the room. It could be one of the girls from the catering department inside having the crack. Do you know, it's lovely, yeah.
I think it has to be the patients and the families.
Yeah.
We're meeting them at such a special time, and they're so vulnerable, but hopefully that we can work with them, like, to make however long that journey is, the best journey that it can be for them. So I think that's at the core of the best part.
They will be very much involved in their care, and they will lead their care in a certain respect. And I think that as the team that's around them, it really is, it's all about dignity and
I suppose
enabling
working
that
with them really
and supporting.
holistically, so it's not just physically and medically,
Oh
it's
yeah, no,
family,
it's so
social,
multifactorial,
psychosocial.
yeah. And we have an awful lot of families who are bereaved, who come back into our unit,
Just
and
to sit down for half
and
an
it
hour.
might be a month later, it might be 4 months later, but you know their face, and then there's just this moment, and there's usually an embrace and just checking in how they've been, and then just their gratitude for the care that their loved ones received. And I think that that's what makes the job so worthwhile, because it's
I think it's
yeah.
they'll always say we give them a lot, but they actually give us so much as well. I think that's and I suppose the thing is, it is very difficult, and like sometimes it just makes me grateful, look, that may be my journey someday, but it's not my journey today, so if I can make it any bit better for somebody, then that's really so rewarding. I suppose first, for the hospice, we'd have to say thank you to every person out there in Kerry, because you know, a lot of people might have seen it, but they have raised astronomical amounts of money, and everything that we have is fundraised by those people.
And they're still doing it, and people are still out there with their buckets and fundraising.
So I suppose number one, we have the most beautiful place for us to work as professionals, but like everybody that comes through the doors, they have a beautiful kind of place to be.